Hey, it's Dr. Candula. Today we're going to talk about, what are the treatment options for sleep apnea. So we talked previously about if somebody has sleep apnea, if somebody has obstructive sleep apnea, they have a throat issue, and then more specifically, they've got an issue either with their tonsils being too big, their tongue being too big for the size of the back of their throat, or their palate being elongated, and most folks have all those issues in play. And so when we treat somebody who has sleep apnea, we look obviously in the back of the throat, we make sure we understand what's going on. We also obviously make sure that their nose is working. That's our starting point before we start anybody down the road towards adequate and proper treatment. If somebody's got a throat that's too tight and has signs and symptoms of sleep apnea, then we'll do a home sleep study and figure out, do they have sleep apnea or not? Based off of that sleep study and their anatomy, we can lock into a treatment plan. And to break it down very, very simply, once again, if somebody has sleep apnea, they've got three different pathways they can take. First pathway is the Cpap machine. Cpap stands for Continuous Positive Airway Pressure, CPAP. That's Cpap. Cpap is the most common treatment for obstructive sleep apnea, and what that machine is trying to do, so what Cpap is a machine that sits on your bedside. It has a hose that comes off of it. Attached to the hose is a mask. That mask can either sit on your nose or on both your nose and your mouth, and what it's doing is it's pushing air into the back of the throat and tenting that area open. So it's not a breathing machine, it's not a respirator, it's not doing that. It's just pushing air. If you think about puffing your cheeks out and you close your mouth and you push out, Cpap machine puffs your throat out. It pushes air in to your nose or your throat or your mouth into the back of your throat, and it's tenting that open. So try as your body might to try to collapse that down, the machine is putting enough pressure in to hold that open. Ideally, that's it. It's not putting more pressure than that, not less pressure than that, just the right pressure. Newer machines can adjust their pressure on the fly. They can give you various amount of pressure depending on the needs, depending on your sleep position, depending on a lot of different factors. So Cpap, that's the first pathway as far as the options for folks who have sleep apnea. A second pathway is an oral appliance. An oral appliance is basically a retainer that you can wear when you're sleeping at night. It sits in your mouth between your upper and your lower teeth. And what it's doing is it's using your upper teeth to pull your lower jaw forward. And so your tongue is attached to your lower jaw. And so if your lower jaw comes forward even a little bit, all of a sudden that opens up your airway and of significance. And so most folks who are good candidates for a Cpap machine are also good candidate for an oral appliance. Most folks never hear about the option of an oral appliance because most sleep centers don't offer that option. So again, that's one option that a lot of our patients use and they really do well with it. Again, if their nose is working. So Cpap is one option, an oral appliance is another option. The final option for folks who have sleep apnea involves procedures. And procedures can run a bit of a gamut. There's a lot of different procedures that are out there to try to treat sleep apnea. All the procedures are either trying to stiffen the tissue in the back of the throat or to remove some of that blocking tissue to make things more open. And there's varieties of this. I won't get into every procedure that we do for folks who have sleep apnea, but if you think about the anatomy in the back of the throat, any of the anatomy, any of those structures back there is fair game. So the most common treatment that's out there when you consider kids and adults is removing tonsils. And so if somebody's got enlarged tonsils that are taking up space in the back of the throat, removing them obviously is going to give you more space back there. So that can help. There's another procedure called a uvulopalatopharyngoplasty. Big name. We call it a UP3 or UPPP. What that means is removing the tonsils and then removing a portion of the soft palate and the uvula usually, and then putting that back together to open things up. So when we do a UP3, what we're doing is opening the sides of the throat up by removing the tonsils, opening the top of the throat up by trimming down the palate, not doing anything to the tongue. And so there are procedures that can be done to the back of the tongue. Those procedures aren't yet as reliable as we would like them to be. And so we're sort of waiting, hoping that there's going to be some advances there that allow us to do more. Currently, if somebody's got a tongue issue, and that's the cause for their sleep apnea, we will typically get that patient into an oral appliance or a Cpap machine because the procedures just really aren't there yet. So if you kind of follow the ball there, Three different options, and I'm purposefully being repetitive, so to drill this in your head: CPAP, oral appliance, procedures. Those could be separate. Sometimes we'll combine, and sometimes, kind of sounds weird, but there are folks who will use a CPAP machine along with an oral appliance. Okay, fine. There are folks who will use an oral appliance along with a procedure. So they're not mutually exclusive, and sometimes it's just finding that right fit for somebody. And if you think about those the last two options, an oral appliance versus procedures, we can mainly work on the sides of the throat and the top of the throat. That's where procedures are. An oral appliance works mainly on the tongue. Procedures don't work very well on the tongue. So, you put that together, and sometimes we'll start somebody in an oral appliance knowing we can do procedures on the throat if they're not quite, if they're not quite where they need to be. Flip that around. Sometimes we'll start with procedures on the sides and top of the throat to see where that takes us. And we can always get them into an oral appliance or a CPAP machine if those procedures don't get them where they need to be. Part of what we do on the front end is putting all that information in front of somebody, not to confuse them, but to make sure that they're empowered with choices, because there are a lot of choices that can be made, and there's not one size fits all. The one size fits all approach that we do take is, I don't care if it's an appliance, if it's a surgery, if it's a CPAP machine, it ain't going to work properly unless somebody's nose is working properly. It's not going to happen. And so you can force somebody you can kind of jam them into a machine or an appliance with a jammed up nose, but you're not doing them any favors. That's the sin that happens outside of our walls on a minute by minute basis, unfortunately. And so there are a lot of people who are trying to do the right thing and trying to get treated and are frustrated by a system that's broken. And so we're trying to do our part to fix that system. So again, everybody should hopefully be an expert on the different options for obstructive sleep apnea. It's not that complicated. 3 different roads. And once we understand the anatomy and each individual patient's desires, so it's really kind of figuring out, well, what's the right option for each person. Depends on what their anatomy looks like. It depends what their sleep study numbers look like. It depends on what that person wants. And so if somebody comes in and is hell-bent against a CPAP machine, and lo and behold, their throat screams at a CPAP machine, their sleep study screams at a CPAP machine, we're not going to scream at them, but we're going to use our best powers of sort of influence and persuasion to let them understand that, yes, we understand that you're not a big fan of this machine, but the reality is, based on your anatomy and based on your sleep study, that this is really likely the best option for you, and figure out if we can make that work. Oftentimes, if somebody's truly has sleep apnea of the severity that requires a CPAP machine and anatomy that corresponds to that, then those folks, the upside with those folks is they are likely to be highly successful with a CPAP machine. So the worse your problem is, the more you're able to tolerate in treating that problem. And I'd say a CPAP machine is on that angle of things. So again, that's all I got today. So sleep apnea treatments broken down in a simple manner. Again, hopefully everybody can kind of get on board with what all that means. So until next time.